Imaging Center at CNOS in Dakota Dunes is providing quick and effective CT scans that could catch early detection of lung cancer before it's too late. KTIV's Morgan Jones has more in tonight's Healthbeat 4.
Providing imaging that could potentially save a life. Since June of this year, the CNOS Imaging Center in Dakota Dunes is now providing low-dose CT lung screenings.
This is more of a preventative screening scan to try to catch the early stages of lung cancer. Those that can catch it early are going to just prevent and increase your length of life.
Jill Sitzman, the imaging director at CNOS, says the CT is very quick, lasting no more than 10 seconds.
I would say it's going to take you longer to get from the waiting room back to the exam room rather than how long the scan is.
In that time, this special type of scan utilizes an extreme low dose of radiation to obtain 3D imaging of a patient's lungs.
It's been a huge benefit for our physicians in-house with our surgical planning, fractures. A lot of the times we can get same-day CT add-ons, so it helps speed along the process if a patient's going to need surgery or further testing after that.
But who qualifies for the low-dose screenings?
There's certain criteria that you need to meet in order to get the low-dose lung screen. Those patients that are ages 50 to 80 that are asymptomatic and have smoked a pack of cigarettes for 20 days, a current or former smoker. Those are the only qualifications that you need to have it. If you already have like signs and symptoms possibly of lung cancer, you would not qualify for this scan.
To see if you meet the criteria for the scan, talk to your primary care physician to receive a referral. For Healthbeat 4, Morgan Jones, KTIV News 4.
And you can see a full list of qualifications for the low-dose screening right now on our website at ktiv.com.